Fellow citizens, I greet you this evening with mixed feelings because of the national crisis of the COVID-19 threat that we face at this time. It has always been a pleasure to share thoughts with you on matters of such importance. But this occasion marks an exception where we are called to greater action, togetherness, and national unity. We can no longer be only observers, reactors, and consumers of information, but must proceed with wisdom and readiness, acting decisively in the interest of our homeland and people. The National Democratic Congress urges all our people to remain calm as the worldwide pandemic COVID-19 grows. With over 6,000 deaths and over 160,000 people infected worldwide, COVID-19 is having catastrophic effects on many countries and communities. Here at home, we are yet to have our first case of the virus officially recorded. Yet a number of our CARICOM neighbors have already recorded cases. It will therefore only be a matter of time before we record our first case. We have heard of a case in St. Lucia recently where the victim diagnosed with COVID-19 was in Grenada for 7 days prior. On Tuesday, the Minister of Health confirmed that in that case, the patient exhibited symptoms while in Grenada, and that some persons who were in contact with the person are exhibiting certain symptoms. These people have been tested, and thankfully, the results are negative. The NDC endorses the Minister's urging to all to observe the protocols issued and to act responsibly and as though the disease is already here. Indeed, it is quite possible that we may have cases that have not been diagnosed. While we acknowledge that in recent days government has intensified its efforts to curb and contain the spread of the virus, we will be remiss if we did not point out that it was recklessness of government to have permitted those early morning flights from China and elsewhere without observing established protocols, particularly in the light of our weak healthcare system. The further lack of transparency in the process led to heavy speculation, which was not good for the country. People remained anxious and concerned about what took place. The lives of our people are paramount above all things. At this time, I encourage students to use these 2 weeks of school to continue to revise your schoolwork and to use the available technologies to connect with your teachers and friends and study together. Your second term is too critical to miss out on any information. The NDC urges the public to follow the general guidelines and protocols issued by the World Health Organization, the Pan American Health Organization, our local health official coordinator, and chief medical officer and his team, so that we can stay safe. Wash your hands often with soap and water, avoid crowds, practice social distancing, and avoid shaking hands with other personal contact as much as possible. Again, the NDC acknowledges and commends the extra efforts that have been made recently and the protocols that have been established. However, we also know that the circumstances change daily and rapidly, and there is always room for improvement. We remain vigilant as citizens and also remain cooperative with all government's efforts, especially in the area of public education and awareness, as we recognize that this is a major national issue, not a partisan issue to score political points. The NDC stands ready and able to continue to support the efforts of the Ministry of Health, and we offer the following suggestions as we believe they will positively contribute to us winning this fight. First, government must be in the shortest possible time put Grenada in a position where tests for the virus can be conducted locally with the appropriate quality assurance program in place. Several other Caribbean countries, including Dominica, Jamaica, Trinidad and Tobago, and Haiti, have announced that they have the capacity to test for the virus. There is no reason why we should not be able to do so as well. Utilizing the resources provided by the Shipping Fund program may prove helpful in this particular effort. Second, step up screening at all our ports of entry, particularly our seaports. Government may want to consider quickly training and diverting some of the traffic wardens to assist with this task. Third, flag cleared vessels with some sort of identification mark. Fourth, enhance surveillance by the establishment of a rapid response team for contact tracing and monitoring, so that possible cases can be quickly identified and tested. A community-based surveillance mechanism would be helpful in this effort. Fifth, infection prevention and control for healthcare workers is absolutely critical. Therefore, we are pleased to learn that the government of the People's Republic of China will be supplying us with some protective and other gear. We thank them for this gesture. However, we urge government to reconsider its call for retired healthcare workers to volunteer on the front line. Being retirees, they will be mostly in the high-risk group of the elderly. Our aim should be to avoid critical illness and death as much as possible. This call puts this specific group of people at particularly high risk. Sixth, we in the NDC are very concerned about the decision to house the isolation unit for people who come down with COVID-19 at the General Hospital. We urge government to consider identifying a facility that is sufficiently isolated from the General Hospital, that combines the space requirements with the contagious disease criteria, so that both hospitalized patients from the General Hospital remain at a minimal risk and new patients with breathing issues and coronavirus could be as comfortable as possible and housed on their own. We urge outfitting and use of the Marylebone Hospital as the best option, not only for isolation, but for people seeking advice or questions by the public on coronavirus. This could be addressed there in one location. And seventh, the update and release of daily information at regular times should be considered. For example, 6 a.m. and 6 p.m., as we do during hurricanes. So minimizing misinformation and rumors. I urge the public not to be lulled into believing the coronavirus is trivial. It can be a dangerous and deadly virus. As we have been told, 80% of the people have mild symptoms and recover in a few days. 15 to 15.5% have severe symptoms, and 4.5% have very severe and must be hospitalized. However, we must know that if anyone catches the virus, it is certainly not a death sentence. You must take special care to observe the protocols if you are over 60 or suffering with diabetes, high blood pressure, cancer, kidney disease, or if for any reason your immune system is compromised. To defeat this virus and its impact on our people, we need all hands on deck. We at the NDC state quite clearly that along with specific, transparent and proactive leadership from our government, we definitely do not need anyone playing petty politics at this time and hiding facts. It is critical for the Prime Minister to deploy a COVID-19 response team to effectively lead the effort against the virus. The team should include representatives from across the society. In the NDC, we have several persons with the relevant training and expertise who can be part of this national effort, and we all stand ready to join in. Last Thursday, on the invitation of the Prime Minister, the National Democratic Congress attended a meeting of stakeholders. We stand ready and able to do much more than that. We note certain friendly countries have begun to offer assistance, Cuba and others, and we are extremely grateful as a nation to them. We encourage government to continue to draw on these offers of help. Assistance and advice should also be sought from the nations where the spread of the virus is being arrested. All of these efforts should be approached with great transparency to the Grenadian people. The Prime Minister has mentioned that 2 million EC dollars has been allocated to the fight of COVID-19. We believe that much more will be needed to delay and minimize the impact of the disease, including the economic and social impact. Our individual economic status will be affected, so the time is now for government to begin considering ways in which our people will be relieved. Here are some suggestions from our party that need to be looked at immediately. 1. Tax breaks. 2. Replacement of income packages as was done with Hurricane Ivan by NIS. 3. The engagement with the financial sector for temporary waiver of mortgage payments. 4. Cancellation of selected fees for affected persons. 5. VAT reduction on certain health and medical items, etc. These are just some of the areas that can be looked at. Once more, I urge all Grenadians to remain calm and focused, follow the protocols established, and look out for each other. We must all look out, especially for the sick, the elderly, and the little ones amongst us. We have done it before and overcome some overwhelming circumstances and diseases in our past with little support, just boosting our immune systems with herbs and spices and caring for each other and taking the good advice offered. The good Lord will do the rest. May God bless you all, and may God bless our Grenada, Carriacou, and Petite Martinique.